While a food-first approach to nutrition is ideal, there are clearly defined circumstances in which dietary supplements are not only helpful but medically necessary. These situations are guided by evidence-based research and clinical practice, rather than marketing trends or anecdotal claims. Understanding when supplementation is appropriate and how dosages are determined helps individuals avoid unnecessary risk while effectively addressing genuine nutritional deficiencies or physiological needs. Vitamin D deficiency is one of the most common conditions requiring supplementation. This nutrient is critical for calcium absorption, bone health, immune function, and even mood regulation. People living in regions with limited sunlight, older adults with reduced skin synthesis, or individuals with darker skin who absorb less vitamin D naturally are at higher risk. Clinically, vitamin D levels are measured through blood tests, allowing doctors to identify deficiency and prescribe the appropriate dose. While the recommended daily allowance for healthy adults may be around 600 to 800 IU, individuals with significant deficiency may require higher therapeutic doses for a defined period, followed by maintenance dosing. Supplementing without testing or guidance risks either undertreatment or, conversely, vitamin D toxicity, which can cause hypercalcemia, kidney damage, and cardiovascular strain. Pregnancy is another situation in which supplementation is evidence-based. Folic acid, for example, is universally recommended for women planning conception and during the first trimester to prevent neural tube defects. Iron supplementation may also be indicated, especially in women with anemia or those carrying multiples, to support increased blood volume and fetal development. Iodine and other micronutrients may be recommended depending on diet and regional deficiencies. Dosages are carefully determined by obstetric guidelines and individual medical assessment to balance efficacy with safety, as excessive iron or vitamin A, for instance, can be harmful to both mother and fetus. Iron deficiency anemia in adults or children is another condition where supplementation is essential. Low hemoglobin or ferritin levels can cause fatigue, cognitive impairment, and impaired immunity. Doctors determine the proper iron form, ferrous sulfate, fumarate, or gluconate, and dosage based on lab results, severity of deficiency, gastrointestinal tolerance, and patient weight. Follow-up testing ensures that supplementation is effective and not causing iron overload, which can damage the liver and other organs. Other medically proven uses of supplements include vitamin B12 for individuals with pernicious anemia or malabsorption conditions such as celiac disease or gastric bypass surgery, calcium and vitamin D in older adults at risk of osteoporosis, omega-3 fatty acids in certain cases of cardiovascular risk or hypertriglyceridemia, and iodine in regions with documented dietary deficiency. In each of these cases, supplementation is targeted, individualized, and monitored. Unlike indiscriminate use of multivitamins or herbal products, the dosage, frequency, and duration are guided by blood tests, clinical symptoms, and established medical protocols to maximize benefit while minimizing risk. The process by which doctors determine appropriate dosages involves several critical steps. First, lab tests and medical history are reviewed to identify deficiencies or increased nutrient requirements. Second, the severity of deficiency and patient-specific factors such as age, weight, chronic conditions, medications, and lifestyle are considered. Third, evidence-based dosing guidelines, often published by professional medical associations, are applied to determine the initial supplementation regimen. Finally, ongoing monitoring ensures that nutrient levels normalize without causing toxicity or unwanted side effects. This careful, individualized approach contrasts sharply with the over-the-counter self-prescription model, where people often take large doses of supplements without guidance, risking toxicity, nutrient imbalances, or interactions with medications. In summary, supplements are truly necessary only in well-defined, evidence-based circumstances. Vitamin D deficiency, pregnancy, anemia, and other clinically verified nutrient insufficiencies represent legitimate cases for supplementation, provided the regimen is prescribed and monitored by qualified healthcare professionals. The key principle is that supplements should address specific, documented needs, rather than serve as a catch-all solution for perceived health concerns. By relying on medical assessment, laboratory testing, and individualized dosing, individuals can safely benefit from supplementation without exposing themselves to the risks of overuse or misuse.